In this video, we're going to go over the organs in the respiratory system. So make sure you can identify all the structures on the models that I'll show you in a bit. And then if you see a star after each structure, make sure you know the function of that structure. All right, so let's take a look at the sagittal view of our head and neck. This right here is our nasal cavity. We have the external and the internal nares. The external nares is the opening into your nostril cavity, and your internal nares are right here. We also have three conchae, the superior, middle, and inferior nasal conchae. These conchae have scroll-like structures inside them. So when the air is flowing into the conchae, it doesn't go straight in. Instead, it's slowed down by the loops that are created by the scroll. Therefore, as the air is traveling through, the air gets warmed and humidified so that you are not inhaling in cold air. In the back region of the throat, this is the pharynx region. The pharynx is not an actual structure. It's just an opening that is divided into three sections. You have the nasal pharynx, the oral pharynx, and the laryngeal pharynx. This is going from superior to inferior. The nasal pharynx is behind the nasal cavity. The oral pharynx is behind the oral cavity, and the laryngeal pharynx is going into the throat. So this is the most inferior layer of the pharynx. If we take a look at the larynx, which is also known as our voice box, we can see the hyoid bone right here, which we studied before. This structure right here in the middle, this is the laryngeal prominence. This is the portion of the voice box that protrudes out. And in men, it's usually deeper than women because of the testosterone hormone. This is the laryngeal prominence. This entire region right here is the thyroid cartilage. We have the cricoid cartilage right here that actually wraps all the way out to the back, as you can see. Then we have the arytenoid cartilage right here. The arytenoid cartilage is going to be attached to the vocal folds. We have the vestibular fold, which is actually what you can see on this top portion right here. This is the vestibular fold. These are actually your false vocal cords because they don't produce sound. Instead, they protect the vocal folds. The vocal folds are your true vocal cords. The vocal folds are actually underneath the vestibular fold. So this is the vestibular fold. Underneath, you're going to find the vocal folds. These are the ones that actually produce the true vibration and helps you with speech. The glottis is not an actual structure. The glottis is just an opening right here. This opening is the glottis. Now, whenever you are swallowing, the epiglottis, which is this flap right here, this is the epiglottis, this is the epiglottis, this is the epiglottis. The epiglottis is going to tilt over and cover the opening to the glottis to prevent food from going down into your respiratory tract. Therefore, when the epiglottis is closing over the glottis, the food and the liquid is going to go down the esophagus instead, which is a structure behind the windpipe. All right, so now let's move into the lower portion of the trachea and the lungs. So we have our larynx up here. Now this is the trachea. This is the windpipe right here. The trachea, and the common name for that is the windpipe. All you see here, this is our tracheal cartilage. These cartilage is going to provide structure and stability to your trachea so that your windpipe does not collapse in the absence of air. We also have the tracheal muscle. The trachea is going to branch off into the right and left primary bronchi. So now we're entering a structure where the trachea branches off. And when they branch off, this branch is going to branch off further and further. So we have our trachea, and then they divide first into the right and the left. Now I'll focus on the left since this is easier to see. The left primary bronchi here is going to branch off into the secondary bronchi. You can see the secondary bronchi here and the secondary bronchi here. And then the secondary bronchi are going to branch off further into the tertiary bronchi, which is found at the tip. And actually, it's at the ends of the tertiary bronchi where you will find the alveoli air sacs. This is the specific site where gas exchange occurs. So we have lungs on the right and left side of the body. In humans, on the right lungs, there are 3 lobes. So we have the superior, middle, and inferior lobes on the right side. On the left side, there are only 2 lobes, just the superior and inferior, and this makes room for the heart because the heart is on the left side. So you can see this notch right here. This is the cardiac notch, and the heart is going to sit in this area. If we take a look at the circulatory system, if we review that, you can see that these right here would be the pulmonary veins because they are taking oxygenated blood from the lungs back to your heart. So you see the pulmonary veins here, and then the darker blue, those represents the pulmonary artery, which is the vessel that takes oxygen poor blood away from the heart to the lungs to get oxygenated. So that's a review from the circulatory system. And then of course we have the diaphragm right here. The diaphragm is a muscle that aids in breathing. And this concludes all the structures of the organs in our respiratory system.